You are live.
Good afternoon, everyone. Welcome to the Jefferson County Health Department Board of Trustees meeting. This is March the 28th, 2024, and it is roughly 4 p.m. Hereby call this meeting to order. If everybody please make sure their cell phones are on silent or shut off, please. Ms. Pinkley, would you please have roll call?
Mr. Pig,
I am here.
Mr. Deal,
Here.
Ms. Stidham. Here. Dr. Henry.
Here.
Ms. Davis. Here.
Thank you. A quorum has been established. Mr. Neal, would you be so kind as to read the mission, vision, and purpose?
I will. Mission of the Jefferson County Health Department is to champion positive health outcomes and behaviors through innovative programs and community engagement. Vision of the health department is advancing the health and safety of Jefferson County. And the purpose of the health center, as described in the revised Missouri statute, is the Jefferson County Health Department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you, Mr. Deal. Next order of business is approval of the agenda. I need a motion.
Sorry.
Pardon me.
Sorry, it was just disregard me.
Okay. Need a motion to approve the agenda.
So
I have a second.
I'll second.
Having a first and second, is there any discussion on the motion?
Yeah, I'd like to move the community service report to number 1 under the public health reports.
Public health report it is. Oh, you want to keep?
The community services
Okay,
report
I'm sorry.
to
Thank
be
you.
before the clinical
You
services
left that
report.
already.
Mhm.
Okay, so we have an amendment to this. So I need a second for that amendment.
I'll second.
All right. Is there any discussion on the amendment? Not hearing anybody, all in favor of amending that to move the community service report to number 1, please say aye.
Aye.
Any opposed? Motion carries. Now we need approval of the agenda as amended. So the first on that.
So moved.
So we have a first and a second.
Yes.
Is there any other discussion on the matter? Not hearing any, all in favor of approving the agenda as amended, please say aye.
Aye.
Any opposed? Motion carries. Welcome guests. We do have a representation from the leaders, so we appreciate that. Thank you very much. We're going to continue on with program. Next is approval of the special meeting minutes on February 20th, 2024. Everybody was here with Ms. Davis. So do I have a first on that?
So moved.
Do I have a second?
Second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Got an abstention?
Yeah, it was an aye.
You-
I was here.
You said, right,
Right.
thank you. Let's see, next on the agenda is approval of the February 22nd, 2024 meeting minutes. Ms. Henry was not here, so do I have a first?
I'll move to approve the meeting minutes as written for February 22nd.
I have a second?
Second.
First and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye.
Aye.
Any opposed?
I abstain.
Motion carries. So the next on the agenda is approval of the 2024 expenditures for $250,844.71. Do I have a motion?
I'll make the motion.
Second.
I have a first and a second. Any discussion on the matter?
Mr. Chairman,
Ms. Davis?
looking at Louis Brisbois for Garden Smith LLP, legal fees, Christy Coleman, legal fees for the past month, on our billing is $15,000. And, again, it's quadruple what it should be, in my opinion, as a board member. I'd like that stated on record. And I just can't see how we can build $4,000 at a time for things without us getting some kind of detail I mean, on our building, it should be detailed. It's not detailed enough. Just like, she gives us a bill, 2 or 3 bills on the same date. And says, in general what she did, but I think it should be more detailed. And, while I'm on the subject, has anything been put out for bids, Mr. Chairman?
That's not part of this. That's not part of this. Do you have any other statements or questions that you wish to make? On the expenditures.
Yeah, just we agree too high and think that's really all that I want to bring out.
So I'm going to just ask the question because I believe it happens, but you do get information from Ms. Coleman on all these expenditures, do you not?
It's, I have to ask
In the
for it,
meeting, we
yes.
say, well, okay.
Yeah.
So there you, so you are able to get it, you can see it, that's all I wanted to reiterate. So, is there, I'm sorry, ma'am,
There are 2 months of billings that were paid in February.
okay,
Uh,
all right, so. Is there any other discussion from any other board members
On that.
on that, on expenditures?
Oh, yes.
Where did you get the number you quoted instead?
so, Mr. Chairman, since he asked me a question, can I address it? Okay, so, from February the 1st. February 1st, she billed us $7,975. Then on February the 15th, still in the same month, she billed us $7,215. So if this is for 2 months, she was not reflecting on our itemized bill here, so.
$3,976 plus $894, not out of $7,000.
What are you looking at? I added it on my calculator twice.
I mean.
So there's two separate areas,
Oh, I see it on the.
2
other
separate
side. Never mind,
pages.
never mind, I got it.
One.
Well, that's, but I believe that was from, I believe that was from last month, correct? So those bills were, those dollars are actually from the previous month.
Gotcha, because it says 2/1.
There's- yes.
So that was for.
It was for the previous month.
Okay,
Okay. All right,
that helps.
I get it. Thank you. I didn't see that. I was up on the other.
I get it.
Thank you.
Thank you.
All right, did you have questions?
I do. This is a question I don't know for the clinical service. To me, it looks like on here we spent almost $30,000 in COVID vaccines this month. Is that correct?
Melissa, if you'd be so kind.
I don't have the invoices in front of me, but so I can't speak to the financials, but we do have to purchase those vaccines, yes.
Well, it said like Pfizer Inc. I'm assuming, and then it has COVID-19 vaccine. Yeah, it came to $30,000 to spend on COVID vaccines at the end of the season. How many doses did that? $30,000.
I don't have that off the top of my head, I can get it for you. Since it has gone commercialized, the price is significantly higher than what we would have had before, which we weren't paying for it before. We are required by our contracts, the adult immunization contract, to have all versions of the COVID vaccine in stock and available to the public.
And that was gonna be my next question. Because and that's, I starting to see a pattern when we accept these contracts and these bids that we have like things that we have to do,
Yeah,
right? Which I knew before,
Absolutely.
but $30,000 in vaccines at the end of the season required is extreme. And how many are we giving? Like, how many did we
I
give?
can get you that number too.
And I did miss, just to bring up February because we were so busy with
Mm-hmm.
things. And this is what I was gonna come in and talk about. And then when I see this, I know we've had some things and I didn't want to stress everybody out.
Yeah.
coming
Well, that
in.
is-
We are making our minimum orders, so we are not ordering in excess.
So
I
we
wanna
ordered
be
this
confident
because
with you.
we accepted grant money or contract money. We accepted money from them and they require.
Yeah, but it's like all other ACIP vaccines. We should, as a health department, have those available to be able to provide.
Sure.
However, because we are receiving some funding through the adult immunization contract. One of the requirements for that contract is to ensure that we have the vaccine available to individuals who want the vaccine.
So then,
I guess as a follow to that, is there some way to push back to get them?
Right.
more funding?
because we're at the end of
So
the,
that contract does not provide funding for the vaccine. It provides funding for the staffing to provide the vaccine. It provides funding for the supplies to provide the vaccine. But typically, most of our contracts do not provide the funding for the vaccine. Now, that vaccine is also available through VFC and 317, which we do not pay.
so I guess my concern now is we just sent $30,000 to Pfizer for vaccine that the season's open.
Yeah.
Because we
do-
didn't have any ordered last month.
We can, if we do not utilize it with Pfizer, we can return it for credit or refund. So that's one of the reasons why we went with Pfizer in the situation when it moved from the way we were handling it before under the emergency situation to commercialize is because Pfizer does have that availability. And,
Is there like a time restraint on that, or how,
mm,
what's the expiration date on those? Do you know, is it,
you're asking
3
very
months,
good
6 months,
questions,
you know what I'm
but I
saying?
don't have that in front of me.
because like how soon
That's when you can get a refund when they go out of date,
you
if
can?
they're not used.
Yeah.
Have we ever done that before that you know?
Oh,
of?
yeah.
Sent vaccine
Oh, yeah.
back?
Oh, yeah.
Okay, so once they expire, if we don't use them, then we get the money back?
Yes, ma'am.
All right, thank you, Melissa. We
Thank
kinda
you, I
went
didn't
down-
put it on the spot.
No,
I
that's
didn't-
okay. I'll try to
Get
get
the
the answers to
information.
your other
or
questions too
information
before you
you
go.
get a chance.
Yeah.
All right. Any other questions about the expenditures for February 24th? We have a first and second, and the motion, the dollar amount was $250,000, $250,844.71. No other questions. I'm gonna ask for a vote, so all in favor, please say aye. Aye. Any opposed?
Nay.
Motion carries. Next is the approval of the 2024 electronic payments for $586,225.29. Do I have in mind? Okay, well, I have the first on that,
I'll make the motion.
A second.
first and second, any discussion? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is for the pre-approval of the April 2024 electronic payments for $602,804.08.
Motion to approve.
First, we have a second,
Second.
and we have first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Public health report, first one has been moved up is community services report.
Hi, thank you for swapping with
Would
me.
you please introduce yourself, so?
My name is Gina Vidicek and I'm the Community
Thank you.
Services
you.
Manager. So I have two presentations today. The bulk of my report that went to you, will cover both of them. We have environmental, food standards program and measles. So I didn't know before we started if there's any other questions that aren't those two things in the report.
We'll probably get some as you go in, like, if that's okay.
Yep. So I would like to introduce Alicia Donathan. She's going to give a presentation on our environmental retail food standard program. She's currently working under a grant that covers the program 100%, and it's looking at the assessment, quality assurance, policy, and procedure of our environmental system.
Thank you, Gina.
Here's your clicker. Thanks. Sorry, I'm working on getting you set up here.
I'm Alicia Donovan. My title is Program Coordinator. I work in the Food Safety Program. My responsibility is to oversee our progress in what is known as the FDA Retail Program Standards. And I'll talk to you a little bit today about what that is and where they've been and where we're going with that. Fran, does it matter what the point is?
No, you have to make sure you toggle the little top part to on. No, there's a little side thing. Yep, sorry.
Thank you. What are the FDA program standards? They're a set of best practices for food safety regulators based on the most current science and vetted by regulators, industry, and researchers across the nation. They're endorsed and published by the FDA, but they're not developed by the FDA. They're developed by a bottom-up process involving those three groups in the first bullet point. They're updated every 4 years since 2001, and the current edition we're working with is the 2022 edition. Who is enrolled? This map shows the 8 food safety programs across the nation that are enrolled in the FDA standards. The icons indicate whether it's a state, federal, district, county, or city level. As you can see, food safety programs at all levels are enrolled in the FDA standards. The stated goal of the FDA retail program standards is an effective and responsive retail food program. And some key features are they are voluntary, 100% voluntary. They are self-directed, so we can pursue conformance at our own pace in a way that works for us. And they're adaptable. So there's no right or wrong way to pursue conformance, and we can make decisions, set goals that work for our program. There are 9 FDA standards, and I'll briefly summarize each one for you. Standard 1 covers our food code. It asks how closely does our local food code align with the FDA model food code. Standard 2 covers staff training. The FDA publishes a model curriculum on which our local curriculum for food inspectors is based. It contains a combination of classroom learning and on-site hands-on training as well.
Did not work.
Yep. Standard 3 covers our inspections program itself. Oh, wait, stop.
Sorry, my bad.
Thank you. It covers the design of our inspection form and the frequency of our inspections, and it ensures that our inspectors are spending more time in the more high-risk facilities, so that we're making a good time investment there. Standard 4 is quality assurance. The goal of this standard is consistent, reliable inspections, regardless of who your inspector might be. So that you can, an operator in a food service facility can expect similar inspection results, and it reduces the likelihood of disputes arising from reports. Standard 5 asks what procedures are in place for foodborne outbreak preparedness and ensures that our staff and our program are prepared in the event of such an outbreak. Standard 6 covers our compliance and enforcement actions and asks how consistently are we following them. Standard 7 is community outreach. This covers things such as our market master meetings in the spring, our serve safe food handler classes that we teach, and our annual food safety task force meetings. Standard 8 asks us to assess how well resourced our food safety program is using FDA published methods. And standard 9 is our risk factor study. Every 5 years, we make a comprehensive study of food safety practices in our facilities to gain a big picture understanding of the food safety culture and challenges in our community. We then write a report. Based on that report, we develop intervention strategies that are targeted to the specific challenges we have in our community to support improved food safety culture. So where we come from? Jefferson County Health Department enrolled in the FDA standards in 2002. 10 years later, we completed our first self-assessment of all 9 standards. That's a comprehensive and very involved process, takes usually 6 months to a year to complete. At that time, we met 3 of the standards. 4 years later, we self-assessed again. We met 5 of the standards. 4 years later, we self-assessed. Finally, we met 3 of the standards. And you probably noticed that we met different standards each time, we don't always meet the same ones we met before. And that's a feature, not a bug. It's not designed to be a one and done achievement, it's designed to be an ongoing process that is dynamic. We intend to complete our next self-assessment in November of 2025 with the goal of meeting 6 of the 9 standards. If successful, that would be the most you've ever met. This is a non-exhaustive list of work that has been completed in the last 2 years under our grant. I'll just let you take a look at that. I won't read all of those. And I want to make an observation that this is very much a team effort. Our environmental staff has worked very hard. So what are some benefits? What do we gain from being enrolled in the FDA program standards? We have a thoroughly trained staff who also regularly pursues continuing education to stay current on most up-to-date feed safety. A quality assurance program, which I've already touched on a little bit. Risk-based inspection frequency, we can ensure that our inspectors spend their time where it'll be most effective. Insight into community challenges, that's what we gain from our risk factor studies, and opportunities to provide targeted support to our food facility operators. Enrollees in the FDA standards gain access to resources such as grant funding. Among other things, we have used the funding from this grant to fund our transfer over to new inspection software and permitting software. What benefits can we expect in the future? So going forward in our next grant cycle, we hope to provide enhanced training for our staff in the event of foodborne outbreak investigation. Enhanced accountability for compliance and enforcement follow-up actions. The standards provide a framework for maintaining the excellence that we've already achieved and a roadmap for going forward, including guidance for setting new goals that will be good for our program and our community. We also hope to become a leader in the newly established statewide retail food network. I'll just end on this. I attended the inaugural meeting of the Missouri Retail Food Network, which was last month. I was asked to speak on our agency's progress with the FDA standards. It went very well, and after the meeting was over, our regional FDA specialist and her co-host commented to me that Jefferson County is an excellent example of progress that can be made in a food safety program pursuing the FDA standards. I think that's a reflection on the work we've done the last 20 years. It's especially a reflection of the work our environmental staff does every day. They really deserve a lot of credit. They've done a lot, especially with being understaffed for the large part of the last 12 months. So let me give credit to them. That's all I've got. Thank you. Congratulations. He's great.
I do have one question.
Yes.
So benchmarking wise, and you may not know this, is there a tracking of how many departments actually reach getting all 9 standards?
There probably is. I don't think it's published on the website, but I
You don't know.
I think-
It's kind of an unfair question, you know.
the FDA regional specialist would have that information, and I could certainly read
I'm
that.
not, just be interested, because I know the standards are, if they're anything like other standards, they're designed to really push you and try you to,
Yes. They
they're
are.
hard, they're hard to meet, I get that.
And very, probably a handful.
Yeah.
If even that, because like she said, they're not designed to, there's always changes and fluctuations, so you may meet at one time, and then when you reevaluate, you don't.
It's like hospitals and termination, I get it. Is that a bad word? Does anybody else have any other questions?
Just for Steve and for this young lady here, as a food service, participant, when I try to get my permits online, it's very difficult program to deal with. Not user friendly. I always end up having to call Joanne. Joanne has to walk me through it. Something don't work, something's off. It causes her more time, and it's supposed to probably make it less time on the staff. It's not doing that. So that really needs to be looked into. To get the bugs out of it, do a different program or something.
Thank you. That's a bit outside my job description, but
Yeah.
I'm aware that that's,
Yeah.
Yeah,
Thanks, Steve.
with any program, you're gonna have some issues, and we're aware of a few. I mean, we gave out 900 permits to facilities. We had maybe 30 something that we had to actually deal with one-on-one to get there. So majority of people are able to work through it, but we know there are some things that make it difficult.
Yeah.
I don't think you're ever gonna have 100% on a system on.
It just needs to be worked on, shouldn't have to call in and talk to somebody, just saying, just instructive. But pretty good.
Thank you for your presentation.
Yep, thank you.
I believe next is clinical services report. Melissa?
Thank
Oh,
you.
I'm sorry. You're not done yet. Okay. Oh,
Slide right into the.
Both be up.
Round two.
How about that? Go ahead.
Okay.
Am I gonna introduce myself?
Who's going first? Whose board report should I pull up?
It's me.
Okay, I'll pull yours up.
So we're gonna talk about measles, and we both are here because both of our divisions, tackle this subject. So that's communicable disease. And so I have investigation and follow-up, and then Melissa has clinic, so she has the vaccine and treatment piece of it.
What page are you on?
It's like the 5th page in my report.
It looks like that one. Is that where you're at?
Yes.
look up on the.
Yeah,
It's up there.
Okay. That's good.
my report's a little out of order from what's in that one, but all the information's on there. So it starts out global and domestic measles.
You find it?
Probably right there.
This don't look like that,
Go.
It's
So an overview, what is measles? So measles is an extremely contagious virus that is vaccine preventable. In the year 2000, we United States, declared measles eliminated, in our country. And that was 12 consecutive months of no transmission on American soil. We've always had cases of measles, but they are travel related and came in and didn't go anywhere. Measles is characterized by that high fever, malaise, cough, runny nose, conjunctivitis, and then followed up with the rash. So that rash starts at the head and travels down to the core and then to the lower extremities. Incubation period for measles, so how long it takes you from the time you're exposed to you start feeling ill is about 10 days. That rash starts at about 14 days. One of the reasons why measles is so important to talk about and such a concern is that you're actually contagious 4 days before your rash starts. So about the same time that you start feeling ill or get a headache or a slight fever is also the day that you could be contagious. So you're walking around for 2, 3, 4 days without realizing that you have measles and that you could be spreading it. How we spread the virus, it is transmitted through infectious droplets. So breathing, coughing, sneezing, it's going to go out into the air, like typical respiratory viruses. Another reason why this is such a big concern is that the virus can stay in the air and on surfaces for up to 2 hours. So if one of us had measles here, everyone that came in this room 2 hours after we left would still be considered exposed.
But if you've already had measles, you won't get it. If you're an adult. Or have to be a baby. Okay.
Measles is so contagious that for unimmunized folks, 90% of everyone that's not been immunized will contract measles if they're exposed to it. So 9 out of 10 folks. You look at the R naught value or RO you'll see sometimes, and that indicates how contagious an infectious disease is. So how fast it's going to replicate. That value for flu and COVID is typically 1 to 2. So if I have the flu or COVID, I'm probably going to get 2 people sick. Those 3 people are gonna get 2 people each, and that's how it replicates. RSV is 3 people. Measles is 12 to 18 people. So it's a huge number. Those outbreaks can spread very, very quickly. It's usually a mild or moderately severe illness, but there can be severe complications such as pneumonia, encephalitis, and death. We're really looking at children under the age of 5, adults over 20, pregnant women, and then anybody with a compromised immune system are at risk for having a more severe illness. It's estimated that 1 in 5 unvaccinated individuals that contract measles will end up being hospitalized. 1 in 20 children will develop pneumonia, which is the most common cause of death in children. And approximately 1 encephalitis and 2 to 3 deaths may occur for every 1,000 measles cases. So it can be very severe. The current outbreak that we're looking at right now, as of yesterday, 64 cases in the US across 17 different jurisdictions. To put that in perspective, there were only 58 cases in all of 2023. So we've already exceeded last year's total number. 93% of those cases were linked to international travel, but that means that 7% were not. So we are spreading it amongst the citizens. Most of those cases from 2024 were among children 12 months or older that had not been properly vaccinated. And it's estimated that 61 million vaccine doses were postponed during COVID. So we know that we are kind of at a deficit there to make sure that everybody's up to date on that immunization schedule. And that's worldwide. For Missouri, there's currently not a measles case in Jefferson County or Missouri that we are watching. Missouri has had, I believe, 2 cases associated with this outbreak, but not in our region. Our communicable disease data currently goes back to 2013 of the system that we're using. So since 2013, Jefferson County has only had a single case. And then we look at the vaccination rates for our community. And Missouri DHSS has done a really wonderful job getting all their information out. So there are vaccines that are recommended and required for kiddos to go to school, and the state has that information. So right now, the state is looking at 90.5% of their kindergartners have been vaccinated fully. In Jefferson County, we're at 92.67, so we are above the state average. In order to get herd immunity, we're looking for 95%. So 95% of the community that can be vaccinated helps protect all those folks that can't be vaccinated for some reason. So we are just shy of that in our schools, but Jefferson County schools have a really good vaccination rate, so we're really lucky for that. Part of the health department, what we're doing internally. So we have activated our, it's our emergency operations center, but it's kind of like our event planning team. So we activated last week at a level 1 just for awareness and planning. Our communicable disease team is reviewing their policy and procedure and getting all of their guidelines ready. So if they have to start making their calls, they have scripts for positive cases, for close contacts. We're working with the community clinic team to help train them up to help with investigation. So it could be a case is a single person and 1 contact, or it could be a single person and 100. It could go either way. So we're making those phone calls to see who's been immunized, and they have to have proof of that record, not just a verbal, and who hasn't, and then what we need to do to go forward. One of the things I wanted to bring up is the possibility that if we had a positive case, we're looking at those 4 days that they're infectious and the 2 hours after they left a room, depending on how much they move in the community, it could be a situation where we have to do like public service announcements to announce, if you were at this facility on this day during this time, please be aware that there was a potential for an exposure. So to remind folks to know what their vaccine status is, and if they've not been vaccinated, what those symptoms look for, and then what are their options going forward. And those options
Will
were
it stop you there? Now, is that a recommendation? Is that something that's a policy that you want to follow through with?
Which part?
The part that you were saying that it would be a public, you would publicly announce blah, 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 blah. Is that something you want to do as a department?
That is something that would be done
Or
in the
is
public
it-
health department. So we look at, we've had lots of different communicable disease, you can see in our reports, we have all kinds of different stuff.
Mhm.
For everyone, we look at what the risk factor is for the community.
Mhm.
Is it something that has to be close contact touching? Then if someone walked and got produce at the grocery store and left immediately, there may be no risk to anyone.
Right.
Because of the time frame and the activity that they did.
So,
we
and you
look
would
at-
show that on our website, Facebook page, website, whatever.
If
when we
there,
see that.
if we deem that there was a risk to the public,
Mhm.
as a public health agency, it would be our responsibility to put that information out.
Okay.
It would be de-identified, so we would never say, if you saw a blonde woman at Walmart, please beware. It would just be a very large, a large timeframe so that people could be aware.
Sure.
And then vaccination, again, this is vaccine preventable. None of this should ever have to happen again, but we're kind of back into this situation. And the vaccine is part of that response if there is an exposure. And that's Melissa's area.
I have one question for you. See, you said vaccine preventable. So you have the vaccine, you're not gonna get the measles.
So it is 93% effective with one dose, 97% effective with 2 doses of MMR.
It's one of our most effective vaccines.
That clears it up. Thank you.
So it's not
I
100%,
know,
but
that's what I wanted to clarify to make sure that, you know,
yeah.
you still must be diligent if you've been exposed regardless. You
Sure.
want to be diligent. Okay, thank you.
So as Gina said, the best thing you can do for you and your family is to make sure that you're following those vaccine recommendations and to determine your vaccine status. So for the measles vaccine, it comes in a combo, measles, mumps, rubella, we call it MMR. And typically children are getting that between 12 and 15 months, their first dose, and then again at 4 to 6 years. One dose, like I said, is 93% effective against measles and 2 doses, 97%. It is a weakened live virus. So what that means is that after you receive the vaccine, your body produces an immune response. And that immune response allows you the protection you need if you become exposed to someone who has measles. Let's see, Gina talked about exposures. Safety. So, this is one of the vaccines that's been around for a while. And there is a lot of safety data on this vaccine. We have this vaccine available at JCHD in stock at both of our locations. We have it available for both VFC, which is for children through the Vaccines for Children program. We also have it available for 317 for adults.
When you refer to 317, what is that?
Yeah, okay, I can talk a little bit about that. That is a program that if you meet certain standards and certain vaccine criteria, that as an adult, you we don't pay for the vaccine, and you wouldn't be charged for it. It wouldn't be something that you could receive it for free. Okay. Let's see, common side effects of the vaccine: sore arm, pain, stiffness, mild rash, pretty common. We can also use the vaccine, as Gina said, in exposure situations. So if there is someone with an exposure and they're unsure of their vaccine status, they can receive 1 dose of the MMR vaccine within 72 hours of that exposure. And it provides some immunity, even that soon. So another option for someone who's exposed is to get a medicine called immunoglobulin or IgG. That's used typically for those individuals who it may not be indicated to provide the vaccine to. Let's see. So there's a couple of things with that you can say, yes, we think you're immune. Like that. So we talked a little bit about timeframes. So individuals who are born before 1957 have a presumed immunity, meaning it is likely they were exposed at some point and have their own immunity. Individuals who have been positive, like you said, who actually have had it and have a confirmed case are presumed immune. Or if someone gets tested, their titers tested, we can say they're immune that way. Or if they've received one or more doses of the MMR vaccine. Yep, that's. Okay, we do, because we do have the MMR vaccine, we have the vaccine information sheets available to anyone who comes here to receive the vaccine, any parent of a child. It's also, we can send it to anyone who's interested in the vaccine information. So it is a readily available information sheet that can provide broad information on whether you should consider getting it, why it's important, and what the potential side effects. Okay, cover everything?
Yeah, I think the only other thing is, if you think you've had an exposure, you're worried that you or a family member has measles, the most important thing is to call your medical provider. Call them first, don't show up. We try to make sure that we are not spreading it any further. So call your provider and they will walk through when you can come in, what you need to do, and help with all of that. I think that's one other thing I wanted.
I appreciate it very much. Any questions? I know it's kind of hopping around in some spots right now, and I mean, the media winds it up, so I just gotta try and a little cap on it.
Yes, well, from eliminated in
Yeah, well, I know.
2000 to the data that Gina provided for this year.
It's
That's an increase.
Yeah, it's a concern. We keep an eye on it, sure.
And
No, absolutely.
so we think that there's more exposure from people that have come into the country, that have been in countries where it's more prominent. Because kids missed vaccines during COVID.
There were a lot of missed vaccines during COVID, but there is also a lot of the other countries outside of the United States are continuing having outbreaks of different types of viruses. So most of everything we've seen up until now has been travel related. So they went to one of those high risk countries and contracted it and then they came back.
Or people come into our country that are. By the millions. I do know something I just want to read here. It's from the CDC, because I'm not, I've worked at a children's hospital over 34 years and I am not big on these vaccines. So I'm gonna read, this came from the CDC and it says from 2015 to 2019, there were a total of 2,051 cases in the US. So that's in 5 years. And our population was 320 million. So that means your chance of getting measles is between 0.000004 to another number way far down. Your chance of dying from measles in the US, if you're an adult, is 0.00, I don't know, it's got like 8 or 9 zeros, 0.6. So according to the CDC, there were absolutely no deaths from 2015 to 2019 for measles.
That's great.
Nobody's dying from it. So
A lot of that, I think, can be attributed to public health across the United States, of making sure that we are contacting people so that they're aware of what could be going on, pre-public health.
Right.
You may not know that you had measles, you had a rash and you didn't know, and it may take you quite a long time to get to your physician. So one of the things that we try to do is provide that education right away, so that everybody has a chance to do what's best for them. And if it's getting treatment faster, hopefully we are saving lives.
The other piece of that, I think, when you're looking at that time frame and over a 90% vaccination rate, there is more of a chance of herd immunity in those situations. So as that vaccine rate drops and the
Well,
cases
even though
go
we
up.
weren't vaccinated and got it, I don't know what the statistics are, kids of this 58. So we have 58 in the whole country. And we're already starting a preparedness thing. That's concerning to me.
Well, I
You
think
know, that we're getting so prepared for 58 out of 30 million.
so part of our
or 300
preparedness
million
here,
people.
is because it's public health and that's what we do, but for us here, one case could extend the resources that I have in communicable disease. So one case with 100 contacts, and we're looking at a 72-hour turnaround. I have 3 staff at my most. It's vacation season now, so I only have 2 today. That is more than they can handle. So I'm gonna be pulling from other staff to try to get those, phone calls made. We wanna make sure they're trained beforehand, because even just-in-time training, as we're in the middle of an outbreak, is rough to do. So for our preparedness, it's really our response preparedness to make sure that we are ready to go at a moment's notice.
And we
those-
kind of already learned that with COVID, right? I mean, we should kind of already be there already.
Yep, COVID had a little bit, we had a little breathing room. TB, from last month, we had a lot of breathing room. We're looking at 4 days of being contagious, but only 72 hours before we can help, get that post-exposure vaccine. So they'll be working around the clock, and that team is prepared. They are already on a 24/7, on-call schedule. There's somebody always with the phone that's ready to take a call, depending on, it could be Ebola travelers, measles, mumps, anything that comes through, that team works. They typically work business hours, but they're always on call. So if it comes through on a Saturday, I also have to be able to pull in nurses to vaccinate, community nurses to help make those phone calls. So that's part of the preparation piece that we do.
I guess I'm just concerned that the immediate response is to vaccinate people first.
That is the CDC guidance and the.
Well, I
and the
understand.
Treatment guidance
some of
and
my-
the clinical.
Well, this vaccine's been
piece.
around, like you said, since 1957,
Is it the same?
58.
Is
I
it
mean,
the same?
Yeah,
There have been a couple versions of this
Yeah.
vaccine, but this live attenuated vaccine has been around for decades.
Well, and have we looked at how many kids have died from the vaccines? I know there's.
That was gonna be my question.
I don't
We've had no
have-
deaths from measles.
There's,
but I'm
there's
just-
nothing,
right.
there's nothing that makes, there's nothing that says you have to get it,
True.
all right?
And
So
that's
this
my
is all
next
education,
question.
this is all education. You know, everybody needs to go with their physician and contact their physician about immunizations if they want it or not. It's their choice. Nobody's saying you have to get it, all right?
So it is a school required vaccine
Ah,
for
it
public
is.
schools.
But
Yes.
what if somebody's a conscientious objector about that type of thing, like, you know,
You
their
can get
religion
exemptions,
doesn't
we did.
allow it or whatever, they get an exemption, correct?
that's on the school district. You'd have to
Yeah.
go through your school district.
The school does. Okay.
All right.
So
Yeah,
I
no,
just, one more quick one. The information sheet, are all the side effects? Not just the rash and fever, but are all the,
I
all
can
the
give you
side
a copy
effects?
of it if you want a copy of it.
Is that from us or from the government?
That is the standard vaccine information sheet.
Okay.
So this is not something we created.
And you know, I'm not coming at you sideways because you
No.
guys just know how I feel about
Mhm.
vaccines. And
We're
I'm just not,
happy to
a-
answer questions.
Is it the handout that the manufacturer gives you?
No, it is not a package insert. This one actually is a CDC vaccine information sheet.
well, that's, I know, CDC is not, I don't think, reputable at this point, in my personal opinion. And and that's why I wanna know the information sheet, there's more side effects on those inserts. If they're in there, than what we're telling the people.
I can get you a copy of the package insert too. If
I
you
would.
want it. That's,
would.
yeah.
The informed consent is really what I'm pushing,
Mhm.
you know, is making sure that people, if we're saying get educated, that we're giving them the right information.
What's that? The package
Yeah.
insert? No, because there's a couple of different manufacturers. So the package insert will be different for manufacturer, but yeah.
And if I could just, I would like
I
one
want
for
that.
for all the vaccines that we give, the inserts and the information sheet, just for my just. Okay, I'm done now. Thank you.
One question, have you followed how many adults have gotten it? Or did she just say within the last 5 years?
I don't think you guys have that information, did you?
So-
Measles,
Adults,
I do not have that information. The CDC has a global measles,
I know what I would ask, how many have died? from measles?
I don't have that information.
Okay.
Like,
So-
hopefully none.
Right.
Up to
job here is to find
2019, no one has died in the past 5.
Right.
Are you talking in the United States, globally?
Yeah.
Yeah.
According to CDC,
Well,
none.
And even in our, and bring it down to our county, you know, this, we've had measles in our society
Oh, they're saying that we died.
forever, you know, and now we're in
No, I
twenty
would say-
twenty-four.
We do have
Oh,
And
statistics,
it's
so
being like super like cool.
But 1 in 5 who contract
That's not
measles
been a
will be hospitalized.
Okay,
So
hold on.
that is a statistic we do have.
I appreciate it. Thank you guys very much. Is there anything else you need to cover? All right,
Any questions about the clinical services report?
I just wonder how many were hospitalized. You say you do have that.
Estimated 1 in 5 unvaccinated individuals who contract measles will be hospitalized.
1 in 5. Okay.
1 in 20 children will develop pneumonia.
Gotcha.
And there's one more statistic in here I was gonna share with you, but now I can't, I seem to have my papers out of order. The other one was on encephalitis. I think it's 1 in 1,000 will develop encephalitis, which is the swelling of the brain, which can cause seizures.
thank you, Melissa. Thank you very much. I'm gonna move on to the health communications report. Dan?
that's all right. Okay, so I'm gonna go through briefly a little bit. If you take a look on the second to the third to last and second to last page in your packet. The analytics that we're used to seeing, I'm going to start putting those in on a quarterly basis. One, because I don't know how many people geek out on website analytics as much as I would. Plus, if you remember the Google Analytics tool, we're switching over to from Florida Universal, it's a whole thing, and I don't have enough data since it was repaired to really like pull those analytics. So I'm gonna just start doing that on an annual basis, quarterly basis, just in case anyone was saying, you don't know where the YouTube analytics are. I kind of redid the way that I structured my report, broke it out into 3 main things: the grant and contract deliverables, our community engagement, and then our organization workforce development, since those are kind of the main programs that we do within health comms. So just kind of giving you an update, we do the overdose stated action grant within health communications, the maternal child health contract, and then we also kind of hang out with some of the other grants and contract deliverables. They're not necessarily ones that are in health comms, so to speak, but like the adult immunization grant is technically one of Melissa's grants, or it's a grant that's in Melissa's department. But we have a piece of it because we do a lot of the education and the marketing and stuff. So kind of just put some highlights there for you. Community engagement as well with some of the different things that our folks were out doing. The Jefferson County Drug Prevention Coalition meeting, meeting with different partners in the area for kind of getting an idea of what services and connections that we can make. And then the Substance Use Prevention Advocacy Day in Jefferson City, and as well as our car seat program. And then internally, because this is a program that's in my section within health comms, it's our organization and workforce development. So I kind of just threw some of those highlights there. We have been using our staff survey results to look at our PHP, which is public health preparedness. Basically what our knowledge and staff skills were in 2018, before we really had a true public health pandemic emergency, versus where we were in 2023, just to kind of see how our workforce has grown. So we're working with that. We're putting together our workforce development plan, which was part of that core competency. And then just working on some of the internal workforce training that we're doing. So leadership trainings, all staffs, things like that. The one thing I did not have on my report is we are part of the Jefferson County Community Health Needs Assessment collaborative team. So you may have already gotten emails from folks at Compass. It is Compass Health, ourselves, Mercy Hospital, and Jefferson County Community Partnership, and then Jefferson Franklin Community Action Corporation. There's 5 of us that are we all have to do a community health needs assessment at some point for accreditation or for any of our funding sources. So we all decided to just band together and do one and really use all of our voices to push that out so that we can learn what the strategic and needs are of the community. So we actually just launched that last week, I think is technically, we pushed ours out, and we pushed it out today through our channels. And I do have some nifty flyers for you, because you guys are, community folks. So I would just love it if you could just, take some of those flyers and hand them out to your folks and, hang them up in your offices, maybe, I don't know. Do something fun with those. Thank you very much. We've got the QR code on there. It takes less than 5 minutes to complete the survey. It is anonymous. There's nothing that's identifiable there, but it really is important that we get the max amount of voices that we can, because we need to know what the issues are in the county. And the more voices that we get, not only the more potential issues that we're aware of, but the more information we get on how to address those, which is super important. So this is the first step, is collecting this data. This survey will run through May 17th. So we're highly encouraging folks to do that. I also encourage you to share it with anyone and everyone that will listen to you, as I am doing now. And then once that data is collected, the survey is closed. I believe we're going to move into some focus group options. We're still kind of looking at that and what that looks like, where we kind of bring a smaller group together and really delve into some of these. We've done that in the past before. And that again is that 5-agency partnership. It's not just the health department. And typically it's about 9 to 12 months before we have all that data compiled. We can really say, okay, here's what we learned. Here's where our biggest problems are. And then each agency will create their own version of a strategic plan or community health improvement plan and say, this is what we at the health department are doing to meet the 3 major needs. So the last time we did one of these, our strategic priorities for the county were access to care, substance use, and behavioral health. Those are the 3 main things. So then we all sit at the table and say, okay, how is the health department going to help with access to care? Versus how is Mercy going to respond to access to care versus schools and things like that. So it really is comprehensive. I really had no idea how really cool this is until I started working in public health. And then the first time I saw it, I was really scared because I was on that committee back in 2017 and I was like, oh, I've never done this before. But I'm really excited to be a part of it again. So highly encourage, if you are a resident yourself, take that survey and then share that out with all of your folks, huh?
So we all better be.
Well, I realized as soon as I said it.
Is this a trick question?
Yes, it was. Thank you. Yeah,
You
I
have
realized.
some digital format that you can send.
Oh, you mean the flyer?
Yes.
You guys run survey. I'm like, oh, yes.
No, no.
Yes, I actually do have that, and I plan on sending it out to all of my contacts tomorrow, so I'll make sure that all y'all are on that one.
That'd be great.
But if you hit up a community location or a Bradco or something, they got a community board, have yourself one of those little flyers and appreciate it. Does anyone have any questions for me? Sorry. Should I ask that?
I could get it posted at the Y unless you've already done that.
We have not yet. Literally, you guys are my first part. Like I told staff, now I'm telling you guys, and it's going to the world. So I deputize you to put some flyers out. Anything else? Yes, ma'am. Oh, sorry. Am I allowed to say something?
I'm getting from people in the community that, they would love to see the comments turned back on the Facebook page and, the YouTubes.
They are.
YouTubes.
Yep.
So that they can comment real time, like as it's happening.
Yep, those have all been turned on since January 1st.
Okay.
Yep.
Good news. That's great.
Anything else?
Okay. And also the Facebook and the YouTube, right?
It's all on.
One more thing, we quit getting the board members no longer got their mail for a long time. If somebody sent a letter to one of the board members, make sure the board members gets this, we haven't gotten it. So
Like
can
a
we turn that back
physical
on?
copy or like the emails?
like the email from the public?
So I have not gotten, because it comes into the communications one, so I haven't gotten one, that's attention to all board in quite some time. I think I've had maybe one or two that have said attention to pig, but that's it. So if it comes through as the board, I send it to all y'all.
Okay,
But
but
if
need to
the
get that word out,
physical-
because people quit trying because it was cut off.
It was
Just
never-
like the Facebook were cut off and
No,
YouTube was cut off,
It was not.
and
cut
the
off.
email was cut off.
It was not.
It
cut
was.
off.
It was,
It was not.
I won't argue with you.
Well,
about
you
it.
Well,
argue
the
with
person
me
who
about
runs
it.
that one, I
We
can
went
assure
over
you,
this
I
before.
didn't, there was nothing internal that cut it off. So if maybe folks were having a hard time maybe getting it sent, or maybe something was spelled wrong, that
Not
would be.
lately, but when Kelly Vollmer had it all routed to her to take care of it all. That's when it quit coming to us.
Well, to
Davis?
my
Make
knowledge,
sure it's reopened.
Davis?
the inbox is working, so.
We all know that was
Yeah.
inappropriate. You have anything else?
No, I'm good. if
Thank
guys
you
are
very
good.
much.
Thanks.
Thank you. Old business, Steve, you want to talk about the new building?
So the report I did is prior to our meeting we had this morning. And really, there wasn't a whole lot to update, except that a lot of the rock and soil that they had to dig, they told us this morning, Tim was at the meeting as well, they're going to be able to use on the site so that they won't have to haul it off, a majority of it. So that'll save us in that cost of having to truck it off the property. And they've actually started digging footings, but they won't be able to pour concrete until they get the final approval from the city of Hillsborough, so we're waiting on that. But they feel like next week, by the end of next week, we'll see a whole different piece of property out there. Yeah, then things should start moving around.
Another photo op.
Yeah.
When do you think we'll have a show? It'll look like.
I don't have the
Something.
dates in front of me,
Yeah,
but
well,
I mean, I would think in June, you should start seeing something.
Mhm.
Anything else? You good?
That's
All right. Ms. Coleman, is there a reason to go into closed session? No closed session, thank you. Well, there is, we need to approve those minutes.
Is there,
Are they ready?
what's that to approve?
There's one side by side.
Okay, there we are. So
Sorry?
we can go in, yeah, for the one set.
All right.
Yeah. Table it till-
Pardon me, I didn't hear what you were saying.
table it till next month, and next time we'll do it at the same time.
Mr. Chairman, I would like to see the minutes, at least have a copy of them real quick before you do that. On that meeting.
Let's do that after. We're gonna go ahead and table the closed session, table that. So
But I'll
you
get
can-
this here.
You could,
Perfect.
you can look at them after. Okay?
That's fine.
All right, new business, we have under new business, is presentation of the 2023 annual report. I believe, Ryan, you're gonna,
Oh, yeah.
is that you or not?
Yeah, that's me. I'm back up. Check it out. Sorry.
That's right.
It won't be boring.
I know this is already, this is already on the, website, correct?
Yeah.
Okay,
Yeah, so it's been on the website since January 31st when it's technically due to the county. So I'm gonna sit over here and present because I didn't bring a mouse, so I can't do that. Basically, this is just a snapshot of our 2023 data. This is, keep in mind, a snapshot, not everything, but chronic disease prevention, how many patients we saw, how many screenings we provided, where whether they were on the youth van, the dental van, the wellness van, injury prevention, a lot of that was our substance use, so medication drop boxes, the number, the pounds of medication collected, the number of Narcan doses that we distributed, our Project Lifesaver participants, car seats, bike helmets, etc. Environmental health was what Gina and then we're talking about earlier, the number of inspections we did in food service establishments, as well as the number of lodging and childcare facility inspections, plus our vector program information is there. Maternal, child, and family health That encompasses a lot of our programs, some of the stuff that Health Comms does, some of the stuff that our family planning clinic does. So there's some of our stats there. And then our communicable disease prevention, just the number of case investigations that we completed, the number of STD tests, TB screenings. Gina had mentioned earlier, like Ebola travelers and things like that that are monitored. So there were 2 of those last year. The number of vaccines and tests provided. This is a very brief snapshot. If you would like to see the more in-depth version, that is on our website under About Us, click reports. You'll see all of our annual reports back to 2018. I think I keep them on there for 6 or 7 years. Do you have any questions?
Anybody have any questions? Go on and see the full report.
Yeah.
Pretty extensive.
Yeah, and I believe that you were provided a copy of it last month in the packets and stuff, but I was sick last month and not able to present then, so,
So you already have a copy. So
yes,
this is
Yeah.
just-
Yep.
Okay. Thank you very much.
thanks.
Next on new business, was act on recommendation to approve temporary pay increase for the deputy director, retroactive to February 1st, 2024. And I believe that was Ms. People. Correct, thank you, just make sure. I have a motion for such.
No motion to approve.
Okay.
I'll second.
And first and second, discussion. Specifics.
What is the recommendation? Or do we need to make one?
No,
Well-
because we did that last meeting.
Personnel committee was going to make a recommendation.
All right, committee, make a recommendation.
I thought we came up with a number.
You did for Steve, but not for Jay.
Oh, this is for you. Oh, okay,
Yeah, for the.
yes, okay,
Temporary.
I'm sorry, like, I
And I
thought,
don't-
or the- oh, I apologize.
What,
And then she's making 100,000 a year, right?
I think it'd probably be a percentage, right? Didn't we agree that she would get them?
we talked about last time, but we didn't do it. to-
Okay, well, let's do it. Is
Wasn't
that what we're doing?
I thought we were approving the temporary of Steve.
I did
Yeah,
too,
that's
I did too, we've already done that.
We already did, Steve.
We already did that, okay, okay.
That was already, that was already a
let's-
sign.
let's
That's already-
regroup.
You already signed that. You're not getting another one, Steve, you're not getting.
Yeah, we're just kidding, it's never about that.
Once you know.
Okay, so we need to come up with a percentage then?
Well, when was her last raise? Jenny's.
No, this.
This is a temporary pay increase.
Additional responsibilities.
Yes,
Yes.
since we don't have a director this time, well, we have an interim director, but she's taking on a lot more responsibility now, which is the 2 of them instead of 3 in like management position. So she needs to be compensated, she's taking on more work.
So what,
In my opinion. Mr. Chairman. It's a conversation. Her job would be a lot easier now that she's not under, the last director, I would think.
okay,
Lot less pressure, a lot less stress, lot less demands.
But the workload is more.
what percentage do we give Steve, do you remember?
I do not, and I can't get logged on
I want to say.
to the.
Oh, it's the number.
I know, so- I did this as 0 and. it
Wasn't a
says-
percentage, it was a amount.
Wasn't
We didn't do a percentage with an amount.
it 20? I think it was.
From,
We made the same.
Yeah. Yeah, we didn't.
I didn't, you're gonna speak up because there's a motorcycle on half deaf,
I'm 120 is what you approved.
right?
As a deputy director, I made the same salary as Jetty, it was 103 something, whatever that percentage is.
Okay. Okay.
So we didn't.
You can also discuss this in closed session and come back out since you have it on the agenda. You just didn't have it on the agenda last month to be able to even discuss it. Just do it.
I thought you did this stuff.
There was a discussion last month, but there wasn't anything on the agenda, so you couldn't act on it.
Do we wish to go into closed session?
Yeah.
Yes,
Mhm.
make the motion.
I make a motion to go into closed session.
First and second, as we pursue to hiring, firing, promoting, discipline, or other particular employees by public government, that's 610.021, section 1. Roll call vote, please.
Mr. Fay,
Yes.
Mr. Deal,
Yeah.
Ms. Simmons,
Yes.
Dr. Henry,
Yes.
Ms. Davis. Yes.
Okay, we've